Hello friends, today we will start the oncology module. We will start with CA vulva. This is a brief summary of the staging, survival rate and the treatment of the CA vulva. Stage 1 involves only the vulva and its survival rate is 80. Stage 1 is further subdivided into 1A and 1B. In 1A, the lesions will be equal to or less than 2 cm in size, confined to the vulva or perineum. But in 1B, the lesions are more than 2 cm and invasion is also more than 1 mm. The treatment of 1A is wide local excision, but in 1B we will look about where is the lesion present. If the lesion is ipsilateral, then there will be radical vulvectomy and ipsilateral lymphadenectomy. But if the lesion is central, then there should be radical vulvectomy and bilateral lymphadenectomy. And if sentinel lymph nodes are positive, then there should be bilateral lymphadenectomy. Then came the stage 2. Stage 2 survival rate is 60. In stage 2, tumor can be of any size with extension to the adjacent perineal structures. It involves lower 1/3 of urethra or vagina or anus, but the nodes will be negative. In stage 3, the tumor can be of any size, but the inguinofemoral lymph nodes are positive. The survival rate of stage 3 is 40. In 3A, one lymph node mets are present, but the size will be more than or equal to 5 mm, or 1 to 2 lymph nodes, but the size will be less than 5 mm. In 3B, more than 2 lymph nodes, but the size will be more than or equal to 5 mm, or more than 3 lymph nodes with size less than 5 mm. In 3C, there is extracapsular spread with positive nodes. In stage 4, the survival rate is 15 and it involves, in 4A, it involves the upper 2/3 of urethra, vagina, bladder and rectum. And in 4B, there will be distant mets, including pelvic lymph nodes. From stage 2 to stage 4, the treatment is only radiotherapy. I hope you like this review summary of CA vulva. We will discuss the summaries of next oncology in next video. I hope you will like it and subscribe to the channel. Hello friends. Today we will discuss the summary of carcinoma of endometrium. In stage 1, the survival rate is 95% and it is confined to the uterus. In 1A, less than 50% myometrium is involved, but in 1B, more than 50% of myometrium is involved. The treatment of stage 1 is transabdominal hysterectomy with bilateral salpingo-oophorectomy and pelvic and para-aortic lymphadenectomy and peritoneal washings should be taken. In stage 2, the survival rate is 75% and it involves the cervix and the endocervical glands or stroma. All this staging is done by MRI. Treatment of stage 2 is radical hysterectomy, which is debulking surgery plus adjuvant therapy like radiotherapy. In stage 3, the 5-year survival rate is 40% and it involves the pelvis. It is further subdivided into 3 types. In 3A, serosa, adenoxa, or positive cytology is present. In 3B, the vagina or parametrium is involved. In 3C, lymph nodes, pelvic or para-aortic lymph nodes are involved. Stage 3 is non-operable, so palliative treatment is done, and if the patient is fit for anesthesia, then perform the surgery. In stage 4, the survival rate is 15%. It is further subdivided into 2, 4A and 4B. In 4A, bladder and bowel mucosa are involved, while in stage 4B, distant mets are present, including abdominal or inguinal lymph nodes. Stage 4 is also non-operable, so palliative treatment is done. I hope you like this short summary. Please subscribe to the channel for further short summaries for revision. Bye bye. Hello friends. Now we will discuss a short summary of CA cervix. This is only for the revision purpose for the last moments. CA cervix is divided into 4 stages. Stage 1. The carcinoma is strictly confined to the cervix and the survival rate is 95%. It is further subdivided into 1A and 1B. In 1A, invasive carcinoma that can be diagnosed only by microscopy with maximum depth of invasion less than 5 mm. It is further subdivided into 1A1 and 1A2. In 1A1, stromal invasion is less than 3 mm in depth, while in 1A2, stromal invasion is equal to or more than 3 mm and less than 5 mm in depth. Treatment of stage 1 is treatment of 1A is cone biopsy or simple trachelectomy or simple hysterectomy. Then comes 1B. In 1B, invasive carcinoma with deepest invasion is more than or equal to 5 mm of lesion limited to the cervix. It is further subdivided into 1B1, 1B2 and 1B3. In 1B1, invasive carcinoma is more than or equal to 5 mm depth of stromal invasion and less than 2 cm in greatest dimension. In 1b2, invasive carcinoma is more than or equal to 2 cm and less than 4 cm in greatest dimension. In 1b3, invasive carcinoma is equal to or more than 4 cm in greatest dimension. The treatment is separate for each. For 1b1, there will be simple trachelectomy or simple hysterectomy. But in 1b2, we do radical trachelectomy or radical hysterectomy. For 1b3, treatment is radical hysterectomy or chemoradiation. In stage 2, the 5-year survival rate is 50%. And in stage 2, carcinoma invade beyond the uterus but has not extended onto the lower third of the vagina or to the pelvic wall. In 2A, involvement limited to the upper two-thirds of the vagina without parametrial involvement, while in 2B, there is parametrial involvement but not up to the pelvic wall. For 2A, the treatment is chemoradiation or radical hysterectomy. Then comes stage 3. Survival rate is 40%. It is further divided into 3A, 3B and 3C. In 3A, the carcinoma involves the lower third of the vagina with no extension to the pelvic wall. In 3B, extension to the pelvic wall or hydronephrosis or non-functioning kidney. In 3C, involvement of pelvic and para-aortic lymph nodes irrespective of tumor size and extent. Then comes stage 4. In stage 4, the carcinoma has extended beyond the true pelvis or has involved the mucosa of the bladder or rectum. Survival rate is 5%. In 4A, spread to the adjacent pelvic organ and 4B, spread to the distant organs. From 2B to 4B, the treatment is same. There is chemoradiation or palliative surgery depending upon the case. This is all for the summary of the CA cervix. Please subscribe to the channel for further summaries for last moment revisions. Thank you. Hello friends, today we will discuss the staging of CA ovary. In stage 1, the survival rate is 90%. It is further subdivided into 1A, 1B and 1C. In 1A, tumor is limited to one ovary, capsule is intact and no tumor on surface and negative washing. In 1B, tumor involves both ovaries, capsule intact, no tumor on surface and negative washing. In 1C1, either 1A or 1B but with surgical spill. In 1C2, either 1A or 1B but with capsule ruptured before surgery or tumor on ovarian surface. In 1C3, either 1A or 1B but with malignant cells in the ascites or peritoneal washings. In stage 2, the 5-year survival rate is 40%. In 2A, extension or implant on uterus or fallopian tube. In 2B, extension to other pelvic intraperitoneal tissues like bladder or rectum. In 2C, either 2A or 2B with ascites
or peritoneal washings positive. Thus, now come stage 3. The 5-year survival rate of stage 3 is 20%. It is further subdivided into 3. In 3A, there are positive retroperitoneal lymph nodes and or microscopic mets beyond the pelvis. In 3B, there are macroscopic extrapelvic peritoneal mets equal to or less than 2 cm with positive retroperitoneal lymph nodes. In 3C, macroscopic extrapelvic peritoneal mats more than 2 cm with positive retroperitoneal lymph nodes. Includes extension to capsule of liver and spleen without parenchymal involvement of either organ. Then comes stage 4. 5-year survival rate is 5%. Distant mets excluding peritoneal mets. It is further subdivided into 4A and 4B. In 4A, there is pleural effusion with positive cytology, and in 4B, hepatic or splenic parenchymal mets to extra-abdominal organs, including inguinal lymph nodes and lymph nodes outside of the abdominal cavity, and distant mets are present. Now comes the treatment of CA ovary. The treatment for stage 1A and 1B involves the surgery. It includes complete surgical resection, which includes total abdominal hysterectomy, bilateral salpingo-oophorectomy, careful evaluation of all peritoneal surfaces, multiple washings for cytology, multiple peritoneal biopsies, hepatic and diaphragmatic cytology, omentectomy, and pelvic and peritoneal periaortic lymphadenectomy. From 1C1 to 4B, there is cytoreductive surgery, which includes total abdominal hysterectomy plus bilateral salpingo-oophorectomy, complete omentectomy, and resection of mets and no residual disease more than 1 cm. It can be treated with chemotherapy, with carboplatin and paclitaxel. 6 cycles should be given. This is all for the summary of CA ovary. I hope you like it. Subscribe to the channel for further summaries. Thank you.